So the operation to insert a penile implant is usually quite a straightforward procedure. There are a couple of different surgical approaches that are used around the world. I prefer to put penile implants in through a small incision in the pubic hairline, little horizontal 3 centimetre incision. One of the important things about prosthesis surgery is to avoid infection. When you put any device inside the body, there's a small risk of infection, and we go to a lot of trouble to avoid it. Some of that's to do with having efficient surgery, quick surgery, so things are not exposed to the outside air too much, but a lot of it is about your technique. I've developed a technique to minimise the risk of infection, and part of that involves a lot of extensive washing and preparation of the skin, but most importantly we isolate the skin when we're doing the operation, because most infections come from bacteria that live on the patient's skin. So we do a no-touch technique, and we have our infection rates down to less than 0.5%. Surgery generally takes around 45 minutes, and patients stay in hospital for 1 night. The great thing about an implant, when it's inserted correctly and through a minimally invasive procedure, is the patient can be using the device and starting to have sexual activity certainly by 6 weeks, but many of them by even 3 or 4 weeks after surgery. These devices are very reliable, and the great thing to me for patients is the guaranteed quality erection they get, and particularly the spontaneity of the erection. It's much better than any of the other treatments we have to cause erections, because a man can establish his erection within about 30 seconds. Obviously there are risks of all operations, but this is not a very big operation, and we have avoided the major risk, which is infection, via the techniques I spoke about. Other things can occur, however, and some men have some issues after the operation, but if it's done by someone who knows what they're doing and done at a centre of excellence, the risk of any complication should be very low indeed. One of the problems in the Australian health system is these devices are not readily available in the public health arena, so they're predominantly done in private, and that's difficult for men who don't have private health insurance. It's probably something that needs to be addressed with the health authorities to make it fair on all men to have access to what is really the best treatment for severe erectile dysfunction.